Breast cancer, resistance to chemotherapy. Understand why breast cancer treatment can fail? In 2020, there were 2.3 million women diagnosed with breast cancer and 685,000 deaths globally. Fortunately, breast cancer is one of the most well-diagnosed and early cancers. According to several scientific data, death rates are decreasing day by day compared to other cancers. Based on personal data, age, health status, menopause or not, etc., and information provided during the diagnosis stage, cancer type, grade, stage, HER2 status and genetic analysis of the tumor, the medical team will propose the most appropriate treatment strategy. Breast cancer treatment, local treatments, surgery, radiotherapy, systemic therapies, chemotherapy, immunotherapy, hormone therapy, targeted therapy. Surgery. Surgical intervention aims to remove tumors in the breast and affected axillary lymph nodes. 1. Breast-conserving surgery. The cancerous lump, tumor, is removed. 2. Mastectomy. The whole breast is removed. Radiotherapy. Radiotherapy uses radiation to destroy the DNA of cancer cells with the aim of destroying them. It is a local treatment that targets the affected area of the breast. Chemotherapy. Chemotherapy is a treatment that uses drugs to destroy cancer cells. Chemotherapy is a standard regime for invasive BC, especially triple-negative breast cancer. Hormone therapy. Hormone-blocking therapy works by depriving breast cancer cells of the hormones that they use to grow. Today, resistance to treatment is a major problem in cancer science because it limits the effectiveness of treatment and recovery, and reduces the chances of survival and life. Breast cancer resistance to chemotherapy. Resistance to chemotherapy is one of the major challenges for the breast cancer treatment. Resistance to chemotherapy is a type of resisting shown by cancer cells to evade cytotoxic effects of the drugs. Several risk factors affect the probability of chemoresistance. Age, subtype, and stage of cancer progression are important patient factors that can influence the resistance to chemotherapy. Chemoresistance is classified into two categories. Intrinsic resistance exists before the drug has been administered to the patient. Acquired resistance. Resistance occurs after chemotherapy treatment. Breast cancer cells can employ a variety of mechanisms to escape cell death induced by chemotherapeutic drugs. Chemoresistance mechanisms. Multi-drug resistance. Several cancer cells are resistant to a broad spectrum of anti-cancer drugs. Multi-drug resistance. Anti-cancer chemotherapy drugs are pumped out of cancer cells and reduce the buildup inside them. Thus, cancer cells avoid death by anti-cancer drugs. Cancer stem cells. Cancer stem cells are a subpopulation of cancer cells that possess characteristics associated with normal stem cells and that drive tumor initiation and progression. Cancer stem cells may generate tumors through the stem cell processes of self-renewal and differentiation into multiple cell types. Tumor microenvironment. The tumor microenvironment can increase hypoxia, metabolic stress and drug release. It can also attract immune cells to cancer cell signals cannot reach tumor, and it decrease the entry rate of drugs used in chemotherapy into cells. Epithelial mesenchymal transition. Epithelial mesenchymal transition is the process by which epithelial cells lose cell polarity in cell-to-cell adhesion and gain migratory and invasive properties, thus promoting metastasis. It is related to cancer progression, metastasis, and mediates drug resistance to chemotherapy. Drug influx and efflux. The effectiveness of chemotherapeutic drugs depends on their successful entry into the cells at an optimum intracellular concentration. High rates of drug efflux in the cancer cells reduce internal drug accumulation and potentiate the cell capability to escape from the treatment. In some cases, several factors, size and physics of the tumor, mode of drug diffusion, structure and function of the tumor vasculature, etc., can prevent drugs from entering the cancer cell. Drug inactivation and detoxification. In some cases, cancer cells develop resistance through drug inactivation or reduced drug activation. It exists enzymes that induce drug resistance through direct detoxification of cancer drugs. Both oxidation and conjugation enzymes play critical roles in protecting cells against many drugs and thus play a key role in drug resistance. Alterations in drug targets. The alteration in the expression level and function of the target enzymes leads to the impaired function of drugs. Dysregulation of some target enzymes are known to cause resistance. Many drugs used in chemotherapy. Apoptosis inhibition. Anti-cancer drugs mainly aim to induce programmed cell death, also called apoptosis. Cancer chemotherapy are designed to kill cancer cells mostly by inducing DNA damage. In many cases, the cancer cells are able to repair the DNA damage caused. This activity reduces the drug efficacy and potentiates the resistance. Enhanced DNA damage repair in cancer cells. Several anti-cancer drugs target DNA damage of the cancerous cells, but using different mechanisms, the cancer cells can repair DNA damages. Consequently, there is a reduce in the drug efficacy and potentiates the resistance. Epigenetic alterations. These alterations mainly affect the function and expression of the cancer cell genes. For example, some cancer genes are exposed to hypermethylation, which yields transcriptional silencing for the tumor suppressor genes. Breast cancer-derived exosome. Breast cancer-derived exosomes are released to alter immune system and cause stromal cell dysfunction in tumor microenvironment. The content of exosomes secreted by tumor cells changes in response to cellular stress induced by anti-cancer therapy, resulting in the transfer of drug-resistant phenotypes among tumor cells in breast cancer. Strategies to combat chemoresistance. Several strategies can be developed by the medical team to try to fight chemoresistance in breast cancer, especially combination therapy, use of inhibitors, use of natural products, increasing the drug response efficacy, early diagnosis of resistance, etc. Use of natural products to combat chemoresistance in breast cancer. Many natural products can serve as substrates to treat chemotherapy resistance in cancer. Some natural products can reverse drug resistance through several mechanisms. We will detail the subject use of natural products in another presentation.